Hi, I'm Jodi Cameron and my student number's 1248112 and my poster's on the fetal transition from uterine to extrauterine life. I'll begin by showing you my poster and then I'll carry on. Okay. Okay, so the fetus has 4 temporary blood vessels that transfer the blood between the fetus and the placenta. They are the ductus venosa, which lies in the grooves in the liver, connecting the umbilicus through to the left hepatic vein and or the inferior vena cava. This carries most of the oxygenated blood, and 50% of the blood from the placenta enters the liver to ensure that it receives significant amounts of oxygen and nutrients, while the remainder enters the inferior vena cava via the shunt. It also has 2 hypogastric arteries, a ductus arteriosus, which moves the blood between the pulmonary arteries and the aorta. This carries medium oxygenated blood, which protects the lungs from circulatory overload. It provides enough blood for the lungs to develop. The foramen ovale moves highly oxygenated blood from the right artery to the left artery. This is located in the membranes that divide the right and left aorta. Okay, so shortly I'll move on to this one. So these unique features of the fetal circulatory systems must adapt at birth or shortly thereafter if the neonate is to survive independently. This adaptation depends largely on the interaction between the cardiovascular system and the circulatory system. So once the cord is clamped, it terminates the blood flow, causing the collapse of the umbilicus vein and artery. This causing a reduction in blood flow from the right atrium, causing a fall in the right arterial pressure. As the pulmonary circulation becomes functional, the pressure in the left side of the heart increases and the right hand side decreasing, causing the foramen ovale to close. The equalization of the pressure of the 2 arteries hold the flap of the foramen ovale in position, stopping the movement of the blood from the right to the left atrium, although this can reopen and remain open for a few days. Right, so temperature regulation. Newborns come from a warm environment to a cold and fluctuating temperature of this world. They are naked, wet, and have a large surface area, with limited metabolic reserves and the inability to shiver. So physiological mechanisms for preserving core temperatures include vascular constriction, so a decrease in the blood flow to the skin, maintaining the fetal position, which this also decreases the surface of exposed area to the environment, and large jittery muscles, which generates muscular heat, and non-shivering thermogenetics, and the large brown fat, which is a special type of adipose tissue with a high concentrate of mitochondria which are designed to rapidly oxygenize fatty acids in order to generate metabolic heat, which these brown adipose tissues, or the brown fat, are located in the fetus's chest down through to the umbilicus, and on its back in between the left and right shoulder blades and just over the kidneys. And this ability to maintain a regular temperature is especially limited in premature infants. So I'll move down onto the respiratory system. While the fetus is in the uterus, the fetus obtains all its oxygen and excretes carbon dioxide via the placenta and the mother's circulatory system. The fetal lungs are not required for gas exchange. At term, the lungs hold about 25 mils of pulmonary fluid, which is partially expelled when its chest is compressed during the second stage of a vaginal delivery. The remaining fluid is absorbed by the lymphatic and pulmonary vessels and returned into the cardiovascular system. As the newborn is expelled from the birth canal, its central nervous system reacts to all the sudden changes in temperature in the environment. This triggers it to take its first breath. With its first breath, there is a fall in pulmonary vascular resistance and an increase in the surface area available for gas exchange. Over the next 30 seconds, the pulmonary blood flow increases and is oxygenated as it flows through the alveoli in the lungs. In the uterus, the fetus exercises its muscles of respiration, practically the diaphragm, and making irregular fetal breathing movements. This encourages the muscle development to prepare it for its first breath. Okay, and also we have got the infant's liver. When the fetus is in the uterus, the mother is producing red blood cells and detoxifying its blood. Once it is born, the infant's liver has to break down the excess red blood cells that is made from when it's in the mother's and has to detoxify. And this is why infants get jaundice, as it's an excess amount of bilirubins. Okay, thank you.